Good afternoon, everyone. My name is Kayla Butterworth, and today I'm going to be presenting a presentation on the SOAP acronym. This is an acronym that is used in medical terminology. It's used in all hospitals, healthcare providers, anywhere that you would go to get treated if you are feeling ill or whatever the case may be. The SOAP is an acronym that stands for the 4 general parts of a medical note. Pretty much this acronym just summarizes in very short terms the process of when a patient comes into the doctor's office, all the way down until your diagnosis or what is going on with you. The first section of the SOAP acronym is called the subjective. This is when the patient will normally come in and say what is going on with them, what they're feeling, what hurts, things like that. The patient will also be giving you all of these symptoms, and all these words will just be used in basic terms. It is then up to you to be able to translate that to your medical team. In order for everyone to be on the same exact page, so everyone knows exactly what's going on with the doctors and there's no miscommunication. What is exactly going on with the patient, so that there's no sort of miscommunication, so that you can properly help this patient and whatever may be going on with them. A few terms that you may see in these notes as well will be acute to chronic pain, symptoms, or abrupt will also be in there. Not only will you find these terms in the subjective note section, you're also going to find things like the family history, the social history, history of present illness, past surgical history, past medical history. You're going to be able to see every time this patient has had these issues, if they're new, if they're not new, basically everything about this patient that you will need to know in order to assess them properly. Moving on to the second section, it is called the objective. This refers to what the test will reveal once you have tested the patient, after they have given you basically everything that is going on with them. These are typically symptoms that are normally seen, heard, or felt, such as palpitations, alert, oriented, things like that. Yes, so after the subjective, where you get all the information about them, what's going on with them, basically the history of who they are, medical-wise, you will then go into the objective, where once you get your test done, based off what the patient has told you what is going on with them, the objective is going to tell you what the tests show. So after you get the background knowledge of who they are and what is going on, then you will take your test, and the objective will be the results of the test. Additional information that you're also going to find in objective notes is going to be their vital signs, their physical exams, any other general notes you may have, again, along with all of your test results for the tests that you saw fit to taking on this patient based off their symptoms. The third section of the SOAP acronym is called the assessment. This is an analysis of the subjective and the objective information. This is only performed by a healthcare provider. So pretty much the terms that you're going to find in these type of assessments is morbidity, mortality, lesion, prognosis. This is when you kind of boil down to finding out what exactly is going on. This is going to be very important in terms of relaying this message to the patient in medical terminology, and then you also will need to simplify it for them if necessary into basic terms. This is telling the patient, this is what we found, this is what we believe is going on. So again, just to go over everything for how far we are. In the subjective, you find out what is wrong with the patient and what is hurting or what is bothering them. And the objective is the test results from the information that the patient originally gave you. And then you have the assessment, where you tell the patient this is what is going on, and then you're eventually going to go into how do we fix it. like I said, how do we fix it? That'll be the fourth step. That is the plan. It's the last and final step of the SOAP acronym. This is the course of action for the patient. So pretty much you're just going to explain to them, we found what is wrong with you, and this is how we're going to fix it, or this is how we're going to make you better in the best way possible. Terms that you're going to find in these notes will be reassurance, supportive care, observation, or disposition. The plan, like I said, is the final step. You're going to tell the patient, this is how we are going to fix you. And that is all I have for you today. So I hope this presentation was helpful and beneficial for you. And yeah, everyone have a good day. Thank you.